Hello, everyone. My name is Luis Basurto, and I'm a research analyst at the Urban Institute. Today, I'll be talking about the effects of sports on mental health, evidence from Title IX. This is work with Professor Sebastián Tello Trillo from the University of Virginia, who is my mentor through this program. Suicide is one of the overall leading causes of death for teenagers in the United States and the world. In fact, according to a report by the CDC in 2015, suicide was the third leading cause of death among persons aged 10 to 14 and the second amongst those 15 to 24. There are many studies that try to better understand the causes of this alarming trend and why it started in the first place. But it's also important to understand what things we can do to improve mental health outcomes for the high school aged population. One of the potential mechanisms through which we can improve mental health outcomes is through the access to sports. Now, there is some evidence about this from psychology studies that shows that sports participation improves physical and mental health. However, although this relationship makes intuitive sense at the individual level, it is not well understood at the policy level. So our hypothesis is that Title IX is a policy that is going to increase women's sports participation and therefore increase mental health outcomes, which for now we are measuring as suicides. So the way we tackle this is by exploiting the variation in implementation of Title IX across states. And I will talk about this more in detail in the next slide, but to give you a sense of why we do this, when we go to high school, like students are not randomly assigned into sports, but rather, you decide to go into sports, which makes causal attribution to sports participation difficult. However, Title IX back in 1972 provides a nice natural experiment to dig deeper into the effects of sports participation. Now, our main data sources include sports participation data from the National Federation of State High School Associations and mortality data from NCHS, which is part of the CDC. And in terms of specification at the bottom, it's just a difference in difference approach. But instead of having, treatment and control, we're going to have a sort of like dosed response where every state gets treated in different magnitudes. So Title IX, just a primer on Title IX, it gets passed in 1972, and it basically says, and I'm paraphrasing here, all schools should have or should provide fair and equal treatment to all sexes in all areas. Now, back then, the main area in which some schools still had discriminatory practices was athletics. And although complying with Title IX is quite complex, attaining equal participation rates for boys and girls is a reasonable way to interpret the rules. Therefore, since different states had different rates to catch up to, we use that as plausible exogenous variation to identify the impact of sports participation on mental health. And you can see here, like the deadline to comply with Title IX was 1978, which is the second line on the graph. And it is now well established that the policy was effective at increasing girls' participation, as you can see here, from 5% in the early 70s to around 25% in 1978. However, our preliminary results find something that goes against our hypothesis. And there are three things that I want to quickly highlight here, and they can be summarized by this event study graph on the right. First, we find evidence supporting parallel trends of our outcome in the pre-period. Groups are evolving in similar ways in terms of our outcome. Secondly, if you were to cut off this graph at 1982, you would probably conclude that there is no effect on suicides. However, and this is the third thing that I wanted to highlight, after 82, we see increases in suicides, and we also find the same effects for males. Again, this is puzzling because this basically says that the increase in sports participation has a negative increase or negative effect on mental health. So we are still looking into this, and don't think this is our final result just yet. There are some other things that we want to try before reaching our conclusion. And that is everything I have today. Thanks.